In this video, we are going to talk about endocrine pharmacology, to be more specific, diabetic medication. First, insulin. So insulin, there are 4 different types of insulin: Lispro, regular, NPH, and insulin glycogen. Insulin Lispro. So it is rapid-acting insulin. Onset is less than 15 minutes. Its peak is between 30 minutes to an hour. Duration is between 3 to 4 hours. With this insulin, you have to ensure that the patient's meal tray is right in front of them when administering this medication. Even better, administer it with meals due to its rapid-acting mechanism. Regular insulin. It's also known as short-acting insulin, so it's short-acting. Onset is between 30 minutes to an hour. Peak is between 2 hours to 3 hours. Its duration is between 5 to 7 hours. With this insulin, the meal tray could be on the floor when administering this medication. This medication is also administered IV because it's clear. NPH. NPH is an intermittent acting insulin. Its onset is between 1 to 2 hours. Peak is between 4 to 12 hours. Duration is between 18 to 24 hours. NPH is a suspension, meaning it's cloudy. It's not to be administered via IV drip. Insulin glycogen, also known as Lantus. Its onset is an hour. There is no peak with insulin glycogen, and its duration is 24 hours. Key things to note when administering insulin is that when insulin is at its peak, we normally evaluate the patient for hypoglycemia, because with medication, we always check. When we do too good, we'll end up with the opposite of what we are treating. Also, after opening a new insulin, it's only good between 20 to 30 days after opening. So as a nurse, make sure you label the insulin and date it, and always initial after you open the insulin. Also remember, if you have a question, what action by the nurse invalidates the manufacturer expiration date is always when you open the insulin. You could refrigerate it after you open it, and for an opened insulin, it's always refrigerated. So side effects of insulin are: there's a risk of hyperglycemia. The signs and symptoms include tachycardia, diaphoresis, shakiness, weakness, and headache. And also there's a possibility of buildup of scar tissue around the abdomen. That's why they encourage patients to always rotate sides when administering insulin. So key points to remember: insulin dose needs to be increased in times of illness. For a fully conscious patient with hypoglycemia, you can give them 15 grams of readily absorbable glucose, which could be 4 ounces of orange juice or an 8-ounce glass of milk. For a patient who's not fully conscious and they are having an hypoglycemic event, and they are not able to safely swallow, so safely being the key word, we administer IM glycogen. Never mix insulin glargine, which is Lantus, with any other insulin. When mixing insulin, always remember clear before cloudy. So we'll inject air into the cloudy, take the syringe out, inject air into the clear, withdraw the clear, then go and withdraw the cloudy. For insulin suspensions, we gently rotate the vial prior to administering. If it's a short-acting and it looks discolored, remember short-acting is always clear. We do not use it. Dispose of the insulin. Oral antidiabetic. Oral antidiabetic medication are only used with type 2 patients. 1. Sulfonylureas. With sulfonylureas, we have glyphosate and glyburide. These medications are used for type 2. They are used to bring the sugar down. Mode of action: it increases insulin release from the pancreas. Side effects include hypoglycemia, photosensitivity, and GI upset. Any medication which has sulfur in it, there's always a risk of photosensitivity. Administration: take 30 minutes before the meal. Patients are not to drink alcohol while on therapy, and they should wear sunscreen because of the photosensitivity. And for pregnant patients, we always prefer insulin if they're diabetic, but glyburide is safe for pregnancy. Meglitinides. Repaglinide is an example of it. It's used for to diabetes to also bring the sugar down, Mode of action, it increases insulin release from the pancreas. Side effects, hypoglycemia and angina. For this medication, it's taken 3 times with meals, 30 minutes before the meal. Biguanides Example, metformin, commonly used drugs. It's also used for type 2 diabetes to bring the sugar levels down. Its mode of action is to decrease glucose production in the liver and also increase glucose uptake by the cells. Side effects include GI upset, B12 deficiency, lactic acidosis, and metallic taste in the mouth. So things to remember. Have the patient take this medication with meals. They should avoid alcohol when on therapy. They may need B12 supplement if the doctor indicates due to the risk of B12 deficiency. Metformin is always discontinued before the procedure that requires NPO or contrast dye. Normally it's discontinued a day or 2 before the procedure. We also monitor the patients for signs and symptoms of lactic acidosis, which include dizziness, diarrhea, bradycardia, weakness, and hypotension. And a side note is metformin can also be used as a weight loss agent in diabetic patients. Thiazolidinediones Example, Piogliatazone. Its use is to bring blood sugars down. Mode of action, it decreases insulin resistance by the cell. It increases glucose uptake since it's decreasing its resistance, and also increases glucose production. Side effect is increased fluid retention and increased LDL and hepatotoxicity. Always remember it's contradicted for heart failure patients due to the fluid retention, and patients should take the medication once a day. They could take it with or without meals. Alpha Glucosidase Inhibitors. Example is Acarbose. It's also used for type 2 diabetics. Its mode of action is it inhibits glucose absorption in the GI tract. Side effects include GI upset, hepatotoxicity, and anemia. Always remember that it's contradicted for patients with GI disorders. Patients should take it 3 times daily with meals with a fast bite. So it should be taken with meals with each meal the patient takes. Hyperglycemic agent. Example is Glucagon. It's used for severe hypoglycemia when the patient is unable to take any oral glucose. Normally the patient will be unconscious or the patient is not safe to swallow. Mode of action stimulates the breakdown of glycogen into glucose in the liver. Side effects include GI upset, which are like nausea and vomiting. Always remember it's administered subcutaneously, IM or via IV route. Provide the patient with food as soon as they are awake or they are conscious and they are able to swallow safely. Safely being the key word here. And when the glucose is all gone, always remember to give them Glucagon. Thank you for watching. Please like, share, and subscribe to my channel. See you on the next one. Bye.